income tax?
Actually, on these, I believe your Social Security and that, there's another part of that. It's a payroll deduction tax.
Okay.
And if it were to need more money, it would have to borrow from the other government accounts.
Okay.
Right now, because it runs a surplus, I believe it lends to the other government accounts.
Is that what Canada has?
Yes.
Or?
The Canadian system is a single pay.
Uh-huh.
So it's like Medicare, but instead of starting at 65, it starts at birth. And right now we have that same system for the indigent here. So if you're poor enough, you have medical care.
Right.
But then if you make around 35,000, somewhere around there, then you are no longer eligible for that. But if you have 4 kids, you might be.
Mm-hmm.
See, we have a very complicated system.
Very complicated.
And then the idea is, are we working, the church's position is that health care is a role of the government to provide, just like we provide school, we provide education universal through 12, we provide for the roads, we provide for regulations so that the banks don't continue to collapse. Remember back, well, not remember, but in the 1800s, bank collapses throughout the world were quite common. You know, that if you put your money in the bank, maybe you get out, maybe you don't.
Oh, is that why people put their money in the mattress?
I'm sure.
Ah.
And it became enough of a problem then, as there was a greater share of wealth being shared, rather than it just the landowners had money, and as they then started investing in industrialization and that, then the need to move money was far greater. Although Knights Templar set up the first real European money moving system.
What was that now?
The Knights Templars. It was a part of the Catholic Church.
I have no idea what that is.
Oh, okay. And in the
I've
Crusades,
heard of it,
in the Crusades, they provided the supply chain and finance chain for the Crusades that to capture and make holy once again the Holy Land.
Now, was that a good thing or a bad thing?
Yes.
A good thing.
Bad thing,
A
good
bad
thing. You know, these things come with.
I don't know that much about it.
They got such a bad reputation then, and became powerful enough that they were challenging the papal authority, and they were wiped out. Or, by other theories, they were nearly wiped out, but they are still there, and they are still managing the finances of the world.
Of the Catholic Church?
No, of the world.
Of the world.
Yeah. And when you see where a lot of the money is located in Luxembourg, Holland, and other places, these were some of their stronghold areas.
Okay, that kind of explains all these conspiracy things.
Yeah, it is a big part of all of the conspiracy theories.
Okay, well, see, it's very interesting to me to learn this stuff because I know bits and pieces about it.
Yeah, yeah.
So, any information is very interesting.
Now, when we set up our current, see, we don't have for middle income and that,
Right.
we do not have health, universal health coverage. So, and when President Obama started the campaign for universal health care, that was thwarted. And by the way, we've been working on this for over 100 years here in this country. So this is nothing, it's not new. It's not new. And Hillary Clinton was working on it back in the 90s, and it didn't go anywhere then either.
I think it's just very interesting that I ended up in a very liberal church. Oh my, you should know the humor in it.
And the Affordable Health Care Act was actually put together by the healthcare industry more than by, something from the people's perspective. Because healthcare, health insurance, excuse me, I can't imagine why I'm getting a phone call. So.
Could be the red bag.
Congratulations.
This is the most confusing thing that has happened. It says it's a call from Jimmy Vermillion, and then it says, just as a text there, but this is the phone ring, not the text ring. Can't talk now. We'll call later. And I don't even know how I get a message like that
What?
in my system.
Why did he bother to call
I
if he
would
can't
call
talk
back.
now?
Yeah.
Because I'll put something on your phone.
Now, is Jimmy Vermillion a friend of yours or a political thing? Or?
No, a high school friend of my two boys.
Oh, okay.
And I'm turning it off, so I apologize for the disruption here.
That's okay.
Yeah. I get so few calls, I expect it to be an ambulance or something like that.
I have a question.
Yeah.
Okay, the insurance companies, I can't understand why they would be for it, because it sounds to me like it would just put them out of business.
Mm-hmm.
And that's not going to happen.
Right, and that is what did happen.
Oh, really?
And well,
Canada?
no, here. We don't have universal health coverage. What we have is affordable care. And affordable care for lower income people, for the most modest plan you can get is like $450 to $650
A month.
a month.
Who can afford that?
And that's not affordable.
No, it isn't.
So then the thing has come in now that the insurance companies have said they needed to raise rates because they were now insuring more people of poorer health, because the insurance was set up through your work. If you're healthy enough to work, then you're not as big a risk as somebody who is not healthy enough to work. So now, as soon as you are no longer healthy enough to work, you are dismissed from your job. When you're dismissed from your job, you then, now that you're in poor health, you do not have insurance. So this was a very profitable model to be working. And as you say, they were not going to give it up. I can remember one part where it was down to the wire and the deal was all falling apart. And the holdup was the pharmaceutical companies. And the spokesman for the pharmaceutical company came in. And just as they did with, they played a major role, and because they came on board, then we were able to resolve whatever the other issues were. Now, remember when the VA system was set up, which is universal pay, that's communist, socialist, the VA healthcare system. It's universal for veterans of qualified income.
Okay. Oh, qualified income.
Yeah.
Ah.
But
What does that mean, non-qualified income? I mean, who falls in that category?
those of us that make above a certain income level, I can't remember
okay.
what it is.
Oh, you have to.
When I go to the VA, I have to pay for services.
Okay.
If I were below that income level, then I just go in and I don't think I can pay copay. I have earned it through service because the calculation is that, particularly if you were drafted, you have lost a life earnings worth of 2 to 3% as a result of that.
That time that you gave the government.
Yeah. Well, and it puts you in less competitive role in that than others were. Mm-hmm. That's why still at state hiring in that, they give you a 5-point credit for veterans in that.
Oh. I didn't know that.
On some government things that have merit, you take your merit exam and that, and they'll give you 5 points.
Oh.
And so there's a compensation.
Yeah.
Okay, then what we run into there, though, is the VA, when it fills a prescription, it has negotiated with pharmaceutical companies. And if I can't get it from you, I'll buy it from somebody else. And they negotiate, and they're one of the biggest buyers in the world. So they have a fair amount of leverage because, I mean, even if it's only a 12-cent aspirin you're buying, if you're buying billions of them,
yeah,
I'm not going to do math, but when Medicare came in and Medicaid, the agreement with the pharmaceutical was that Medicare cannot negotiate for prescription drug prices. They go to the pharmacy and whatever it is that they're paid, that's...
Oh my goodness.
Yeah, they can't negotiate for it.
That doesn't seem it doesn't seem cost effective for the Medicare people.
But if that had not been agreed to, then the lobbyists that they pay would have been able to prevent it from going through.
Okay.
So even like with this most recent one, there's no one, you would think the government is representing us, but they seem to be coordinating financial interests rather than our financial interests. It's a bit disappointing, and there are huge campaigns out to besmirch the medical universal pay systems in other countries. And there are people that actually move to Canada so that they have health insurance. The British system, it's a kind of you can pay for an upgrade there on some things. I'm not real clear on it. If you write down your email address, the things that were in, okay, we'll do it later, or I'll get it from, it'll be on the care list.
Yeah.
Okay, I'll get it.
Barbara has everybody's email. Oh, Nancy, when is your birthday?
February 10th.
Okay, thank you.
18 what?
1890.
We don't need the year.
1946. I'm one of the first baby boomers. I'm one of those awful people.
Oh.
In February, too. Like the very first one.
Yeah, huh.
People take shots. I'm ruining the country, don't you know?
I'm in the baby boomer category.
Are you?
Yeah.
I don't quite I'm on the other side, which was very fortunate because they could see the boom coming. So they had to start the building projects and that for school, 6, 8, 10 years earlier, or something like that. And I got into them when they were new and practically empty. And then you all came in and filled them up.
Yeah, I was born 9 months after my dad got over the service.
Oh my, you were a baby boomer. Yeah.
Boom.
Yeah. Wonder what they were doing.
My birthday is September 24th. The gift that keeps on giving. If you count back for the conception date. Christmas.
Huh.
I would have been
really
conceived.
missing something there.
I would have been conceived on either December 24th or 25th.
Oh, I see.
depending on how
I'll be
you
darned.
count that.
Okay.
The gift that keeps on giving.
Yeah.
I see. Now I understand.
Okay, so anyway, we do not have universal health care, but we do have a single pay care system with Medicare, Medicaid, and the Veterans Administration. The VA, Medicaid, and the Veterans Administration. The VA, the delivery of the service, once you are accredited, appears to be excellent, and I get VA care as a part. I have regular health care that I pay for, and then I also get the VA that I then get back charged for. So, and it's not at this. Well, a doctor's visit can be anywhere from $35 to $85. So it's not the rate that you would get on the open market, but it's still not free health care. Mm-hmm. But my experience with it is that it's excellent care, very good care. It's not, so like, we hear a lot of complaints about the VA, but that appears to me to be on the processing and admission side to it, to get your benefits. Once you're in the system, then the benefits that you are to be provided are excellent.
Would it bother you if I switch that stuff, because it's still backwards?
Oh,
The
no,
water
go.
should be at this end and the cake at that end.
Yeah, go right ahead.
Okay.
And if you would like to unbox the cake, go ahead.
Unbox it?
Yeah.
Yep. It's kind of like deep planing, but it's unboxing.
Oh.
Oh, there's Don Cooley.
Good. And now it comes down to then the question, is health care like education? Is it like the roads? Is it like having the court system there to resolve our disputes? Is it a basic function of society? And in the U.S., it appears as though, kind of, we don't want sick people dying out in the street because then you have to go pick them up or something. I don't know why. And then if you are, again, quite poor, then you will at least get emergency services. Where that system tends to fall apart then, though, is that there are restrictions on how the benefits are distributed. So if you have a chronic condition like diabetes, when you've collapsed, you can come in, but then you may not be able to get the sustaining medication to keep you from collapsing the next time.
Oh, really?
Yeah. The system hasn't developed to the point where it covers all of these contingencies in that. So.
Well, now, does Obamacare have any effect, or Affordable Care Act, does that have any effect on people 65 and older?
No.
Yeah, I didn't think so. Because then Medicare kicks in.
Mm-hmm. And now, it does have an indirect effect because my insurance rates through my retirement plan doubled this most recent negotiation period. And presumably because the insurance company needs more money to be able to sustain itself, because now you can't cap any longer. So typically an insurance policy would have about a lifetime cap of $1 million or something, and so once you've spent that up, well, in these times that's not all that much.
No, it's not.
And when they cap, then your benefits are over. Mm-hmm. The other part is that they did not have to cover for pre-existing conditions. So you had to stay with the insurance company you had, because if you tried to switch and you had, say you were diabetic, you were covered here because you had developed diabetes while you were on their plan. But now when you move to the next plan, they can deny you coverage. They cannot do that anymore. See, so there were a lot of things in the health care bill that did reorganize and restructure. And just those two things, not being able to refuse coverage for pre-existing and not being able to cap, that does cost the insurance company money. Mm-hmm. Because before, like as soon as you got sick and then lost your job, you were out of the play. So their expenses have increased, but only because they're actually now providing actual insurance and legitimate financial support through illness. Biggest cause of bankruptcy in the United States is medical bankruptcy. Mm-hmm. Those who have encountered bills.
And now the clause about your children being covered up to the age of 26, is that if they live with you or not?
I think you can cover them regardless of where they are. The thing is, and that's not such a big deal, A, because it's a healthy population, and B, Utah has always, well, not always, but it has had a long-standing age 26, because that gets their youth through the 2 years of mission and 4 years of college. Because previously, if your child was enrolled in college under our old plans, then you actually could continue them on your insurance policy. And now, whether they're enrolled or not, you can include them on your insurance policy. And in Utah, because their moral commitment and participation of the church in government affairs, by voicing, not controlling, by voicing what they believe is a policy that's good for society, and they advocate for it, their legislators pass it. And it would be hard to go back to your ward and tell, no, I'm not going to vote for that, because they are actually accountable to the people there. Hey, Julian.
Sorry I couldn't get in earlier. I wanted to hear this, but...
David's been educating Nancy and I about our healthcare system.
I did not have Nancy's email address,
right.
So the resources that I sent out, I didn't send to her, and
right.
So we missed that part.
So how are you doing?
Okay.
Good.
Yours here?
She will be.
Okay.
I told her she had to drive herself, and let's see if she goes. She gets up and comes to church.
Yeah, because you're in service today.
Yes, I am.
Yeah, so I feel like not everybody is in favor or support of universal health care, but
well, what else are you supposed to have? You either have a system, if you're lucky you're employed and your employer's doing this and you have no idea what you're spending on it, and get a little upset when he charges you $1,000 a year to throw in something, the copay keeps going up.
yeah.
So, but when you have to buy it on your own and you find out you can't afford it, what do you do? It's
You get a catastrophic policy that
right. Well, that's what you're supposed to do. Not everybody does that.
Yeah.
A friend of mine who is very much against public health care. So I heard him make a statement this past month. He says, I never believe. He had a situation in his house where somebody tripped and fell and broke their leg. It's a university professor. Apparently, this person didn't have health care. Provided by the school. Maybe they were a full-time professor. I don't know what the story is, but they're very well educated, PhD in astronomy, the whole 9 yards. And he said, I can believe how many people don't have health insurance. And even today with Obamacare, not everybody's buying into it.
I know, yeah.
So they rather pay the fine. Eventually, maybe it'll go up and they'll have to. But I'm flabbergasted. We're the richest country in the world, and we don't provide health care.
But there's a mentality in our country whereby if you... I don't want to help pay for your health care if you're being lazy, sitting at home all day, eating bonbons, and I don't want to pay for your health care.
You're paying for it through your taxes. I mean,
but...
it's and you pointed that out to me. is the way the tax system is. The hospital writes them off and writes them off on the taxes, and you and me end up paying for it.
Yeah, I know.
And they inflate the cost, so they're covering their real costs with a tax write-off.
Right, but I mean, what I'm saying is there are a lot of people in America today that have that feeling that,
Yep.
well, I don't want to pay for your insurance if you're not working and you're not trying to pay your own
Right.
way, and you know.
Some people will say there are 25% of the people in the country who are on welfare.
Mm-hmm.
I've heard that comment. I did some research on it. I noticed it's like 4.8%. But if you count everybody on a government pension, everybody on Social Security, everybody VA, okay, then it comes up to that, and they'll even distort the figures more by saying that they'll look at one household with let's say 5 people living in that household. They'll count that as 5 people on welfare. If you have a household where you have one person working, they don't count the 5 people who live there for the one person working. So if you use those statistics, there are more people on welfare than there are people working.
That's an interesting.
Oh, these people, they don't, they bend the freaking rules like a hairpin.
Apparently.
Yeah.
So,
And both sides do it, but we seem to see
sure.
more of it in public advertising from the right, rather than well, and it's easier to lambast things like this, but you know the numbers get twisted significantly.
Right.
And what we are becoming is by not paying minimum, watching our minimum wage, not having that health care and that, we're becoming 2 countries. And one of the, somebody that is well-known and wealthy does not have and says he does not have an objection to some of these, you know, more progressive taxes that they're talking about. Because he doesn't want to be a rich man living in a poor country. Because I mean, I don't know how much you've traveled in that, but if you go to some of the very poor countries in that, I don't care how rich you are. Some of that stuff is still just
Yeah, they
pretty
don't.
nasty.
Yeah, they don't want
money,
to
that's
walk
what
among the unwashed
Yeah.
masses.
Yeah,
Well,
and
take Cabo San Lucas. That's part of Mexico? Yeah, not really. They built a wall there. There's a fence there, and if you're Mexican, you can't get in there without the proper credentials unless you work there. And
Right.
it's just like another country within a country. Yeah. Maybe you can swim around the fence. I don't know.
yeah. But again, his point being that he wants to support things like health care and that, so that you have a country where, you know, as your kids wander around and roam around there in the what we used to think of as the U.S. as being, you know, and it's becoming less and less that. But,
The minimum wage. Did you hear about the restaurant in Seattle, Washington? Now, I think they've got a mandatory 15%. Now, not 15%, but $50 per
$15
hour.
minimum
But
wage.
before they passed that, this one restaurant decided we're going to pay people $15 an hour, and we're going to do away with tips. No tips. And everybody gets the $15 including the line cooks, which they didn't get tips before.
Oh, yeah.
The workers are ecstatic. They love it. They're not getting stiffed on tips.
Right.
The customers love it. They know they have a set price they
Yep.
pay. Do I tip
This
on
is the
tax?
bit.
Do I not tip on tax? I can't keep it straight.
Yeah.
Well, how do I do that in my head without my smartphone?
And how much do I tip? And
Yeah.
Right, exactly.
And do I tip because I got bad service today? But hey, I've had bad days at work, and they didn't take that out of my paycheck. You know,
True. That's very true.
you know. So, it's,
I'm a
how
big
did you
tipper,
end up
so-
here, Nancy? Keep asking yourself that.
I leave a big chip.
Yeah.
We used to.
Well, here I do because it's a tip economy.
Right.
It's a tip economy. You
Right.
expect
Exactly.
to do that. In the Midwest and other places, I still do it now because that's what I do. But it's not a tip economy there. So, people don't view it the same.
Really?
Oh, my goodness.
Yeah,
I've
now
never
the
heard of
wages,
business.
the wages are still the same,
Right.
Yeah, but-
Well,
you know, they, tipping is not as generous there.
yeah, they're probably
Yeah.
still tipping 10% or
Yeah.
something like
Yeah.
that.
And I think it is also based on service, quality of service as well.
Yeah, which was
We-
originally
We're
what
here, we don't,
we just kind of do it.
yeah, what's the bill, you know, having a hard day, well, I hope this makes you feel better.
And they, you know, the opponents of the $15 minimum wage have a point. It doesn't cost the same thing to live in Podunk, Iowa, as it does to live in New York City or San Francisco.
Right.
So there is a point to be made there.
Yeah.
Well, and there were some people in the Silicon Valley that were, and I think another group in New York City that were advocating for increasing the minimum wage when they realized that the housekeeper, bellman, and other things in their the facilities and that
Yeah,
were on
there's
food stamps and
Oh, yeah.
other things, you know, that they were poverty, and
Yeah.
and they were working, you know, every day like anybody else, show up on time, leave on time, these sort of things,
Yeah.
punctuality.
Can they afford health insurance? Probably not.
No. Oh, and the health insurance does provide, if you're at a lower income rate, it will subsidize, it will pay part of your health care insurance when you can get the system to work. And it appears to be working now, but
Yeah.
so. But anyway, as a church, the 2016 is coming up, and in 2014 they added to the 2012. The social principle ended with, and we believe that everyone should have health care. The 2012 one then ended in, and we believe the government should pay for it. Is there anything that we should be adding to the 2016? Because they'll be meeting in Portland. Y'all can go out. Volunteer.
That's an
At the
appropriate
general
place.
general conference?
Sorry.
Yeah.
Yeah, General Conference is in Portland in 2016. And
A progressive area.
Exactly.
Yes.
they're looking for volunteers to
Connected.
go and
Yeah,
help.
beautiful, but no beaches. But
Well, there are beaches.
Yeah,
You just have to wear a jacket.
yeah.
Yeah, right.
So,
But anyway, so right now, the Methodist Church says that everybody should have affordable health care and that the government should pay for it.
and the government should pay for it. Yeah.
Interesting.
So.
Well, I agree with that.
And the other point that I had wanted to
Hey,
make
Terry.
was that healthcare and religious organizations have been tied together for millennia, because, and if you look back, so the first hospitals in that were religious, well, Catholic hospitals,
And nuns were nurses.
right? And now you look at it, St. Rose de Lima and the other Catholic hospitals in our area are now a part of Dignity Healthcare, and so we are moving from not-for-profits into for-profits. And by the way, not-for-profit doesn't mean that that they're making a loss or anything. Some of the not-for-profit salaries and benefits in that are quite generous, and should be. I mean,
You're competing with the same,
yeah, you're
same talent group.
right, and so you know the idea that because they're not-for-profit, then when they put the sheetrock up in the clinic or whatever, they shouldn't even bother to finish it or paint it. I mean, it does the job. It restricts the fire hazard and it keeps the cold out. So
Stop there.
Yeah, just stop there and let So, but a lot of people get the or there is an attitude out there that not-for-profits should be very
Austere.
spare. Yeah, austere. Thank you. Yeah, thank you. So, but anyway, the dynamics in the healthcare industry and the role that religious organizations play in it has changed fairly dramatically over just the last 15, 20 years. That and there's a lot of consolidation in that. And remember, every time you get more consolidated and more efficient, that what that means is there are fewer jobs. It doesn't mean that aspirins cost less. It means that you have fewer people in different organizations buying them. And hey, that's not the worst thing in the world, but as we are a consumer society and we're creating more and more non-consumers in our society by reducing the number of jobs, then it's a recipe for disaster.
Well, yeah, and the rises in the service industry where typically salaries have been much lower.
Yeah. Mm-hmm.
That's, politicians. Well, I brought more jobs than I built to Walmart. Big deal. What do they pay? They don't pay minimum wage many times. They hire people for 20 hours a week,
Mm-hmm. Yeah, no, they just did something progressive.
Yeah, they did. They absolutely did.
I think they went on board with that. Well, and yeah, because their business model has not been one that I've been impressed with.
Right.
Okay.
I guess that means that I shouldn't put my Jeb Bush sticker next to this one on my car.
Well, no, Nancy, no, not at all. What it means is, though, that you should write him and tell him that, as a good Methodist, and presumably he was,
I don't know if he's a Methodist.
No, I don't think he is.
His brother and his father were.
Yeah, but in any case,
he may be.
all politicians are men of great faith.
Oh, of course.
They're
honest, too.
Yeah, and you should tell him that this is something
Like
that
Donald Trump?
I'm not sure Donald Trump fits that category.
I'm going to register a Republican just so I can vote for Donald Trump in the primary. I think Hillary can clean his clock.
Well, be careful what you wish for. But anyway,
yeah.
Letting your representatives in that know what you think and believe is
it's important.
It makes all the difference, and so few of us vote. It's interesting that here we are, a country, a democracy, trying to offload democracy to the rest of the world, and we don't bother to vote.
I just don't think that anybody has it figured out exactly how it should work yet. And I don't want to see anybody sick. And especially like if they have cancer or something.
Right.
I truly believe that everybody should have, be taken care of like that.
Mm-hmm.
And I don't think
that... I don't know.
But you need to let the people you vote for, you need to let them know how you feel about that. Well, so that they don't go and represent you as, oh, no, we don't want to pay for a poor person who has cancer. Right. I mean,
But they do that on a platform committee. The national.
Right, but it does filter
they can't go against
the system is a lot more responsive than you think. We just don't ask it to respond. That's our problem. It's interesting. Giuliani, very opposed to any privatization of health care, former mayor and then governor.
Oh, okay.
And Lindsay, the former mayor, this would have been back in the 60s and 70s, very opposed to any of these health care type things, Medicare and all of that. And they're both from well-off families. Lindsay ended up with extensive medical difficulties later in life, and for some reason the insurance, or he didn't even have the insurance, or it wouldn't cover it because maybe he had switched and not realized it, something like that. Two men opposed to public health care. Giuliani appoints Lindsay to a city position so that he does not show up to. He does not work. I don't know that he got paid, but he got the health care benefit. And that's worth millions right there.
Well, a friend of mine's wife has cancer back in Connecticut, and he was telling me, he said, a lot of the drugs cancer treatment are not covered by Medicare.
Right,
Yeah, that's right.
yeah.
Thousands of dollars each paid
That's right.
for this stuff. That could be very well the situation, and that's.
Because they can't come
they
to a
got-
negotiated.
No, they can't.
Oh, well, no,
They-
that one they can't negotiate.
Well, they can't,
Yeah.
well, do they cover or not cover, but even the ones that are covered, they can't negotiate the price. They're
Yeah.
not allowed
Yeah.
to by Congress. And that's all the drug companies negotiate with the insurance companies. Why are you not that? Because they've built this thing for the benefit of the insurance companies.
Yeah, because
Exactly.
Yeah. I'm buying
They need to get-
I'm buying some of my drugs from
I
Canada.
know. I need
Hell
to get
with
rid of the insurance companies, but
No.
no, that's not gonna happen.
And I'm getting 2 drugs from Canada, Marge is getting 1.
Yeah, there's still a lot wrong with the system.
Yeah.
And we
Oh,
could-
yeah.
But
we're
what
buying
an
that-
need it.
advantage then, we actually have
30
a
cents on the
mission
dollar.
and something we can do in life that's worthwhile, rather than just run off on our jet skis or
Yeah.
go to
I
a baseball
actually agree
game.
with that,
And,
this universal health care, as a Republican, but I think that they need to figure it out first, not just pass laws.
well,
They need to give us some thought.
they had a universal health care package there, basically the same thing that we have for Medicare.
Hey, Dave,
And
come on in.
that was considered unacceptable.
Ah,
They would not expand Medicare even, a year up, a year down, or anything else. It was very hard to get the Medicaid stuff through for the very poor.
I'm gonna go get one.
So,
It'll be hot by the time.
It's apparently quite a powerful
So,
group there,
in that
and they are influencing our legislators because it is still our legislature. The lobbyists do not vote. It is, and the pharma companies, and the insurance companies, the banks, they do not vote. They may be persons, but they don't get even to go to the ballot and cast one ballot. We're the ones voting, and we're apparently irresponsible because we know more about your NFL player or your favorite baseball player's stats than we know anything about in the voting record for our representatives in that.
correct.
And it's shame on us, and shame on the churches because we were active in health care and seeing to it that the poor were taken care of. We don't do that anymore. One of the things we've allowed then is, well, if they can get Medicaid, Medicare, if they can get food stamps, then we as a church don't need to be involved. Well, what happened is we stopped being involved, and you can barely get food stamps, and now they run out after 4 months anyway. So,
Really?
yeah, that big system out there that we're complaining about really hardly doesn't even exist anyway. Okay, that
Very
wraps it
nice,
up.
David.
Next week is mental health, and I'll have your email address, so you'll have those resources to look at. Without internet connection here, I can't bring those in, and every time I've tried to